The National Educational Association of Disabled Students, NEADS, is a by and for cross-disability, cross-Canada charitable organization supporting full access to education and employment for disabled post-secondary students and graduates. NEADS works across 3 strategic areas of debt reduction, experience in class and on campus, and employment. By doing so, we offer a variety of events, resources, reports, financial assistance programs, and opportunities for disabled students and graduates. We collaborate with post-secondary stakeholders, other non-governmental organizations, employers, disabilities service providers, and community members to improve opportunities in higher education and the labor market for disabled students. We also provide ongoing advice to Employment and Social Development Canada and provincial or territorial governments, and work to promote government programs and services that support higher education for disabled students.
The Virtual Access for All project is a 2-year project with an additional 2-year expansion, funded by Employment and Social Development Canada's supports for the Student Learning Program. This project aims to empower and support disabled students whilst they navigate through the many facets of post-secondary education. NEADS recognizes the layers of ableism prevailing within these institutions. Our team thus strives to offer programming in which mutual care and collaboration is at the forefront, that provides spaces for discussions and resource sharing. Such examples of programming include, but are not limited to, the following: monthly webinars with disabled activists and students, community members, collaborators, and partners, hybrid tour stops at post-secondary campuses throughout Canada, as well as quarterly reports highlighting challenges and successes of post-secondary institutions through disability and intersectional lenses. Lastly, this project has allowed an expansion of our financial assistance program and funded our accessibility resilience program.
Thank you, Sheila and Elizabeth. And hello, everyone. My name is Chloe. My pronouns are she and they, and I'm Link's educational programming director. I currently reside on the traditional territory of the Andaman Anishinaabe, Haudenosaunee, and Lenape peoples. In the scope of my position at NEADS, I often collaborate on projects alongside brilliant fostering cross-sector partnerships, such as Tess. Tess is the National Youth Episodic Disability Initiative coordinator at Real Life, and our organization through its incredible initiative brings together disability, HIV, and rehabilitation. We are also joined by Rome, a community expert storyteller. Tess and Rome will discuss findings from an environmental scan that highlight the barriers, gaps, and opportunities in employment support programs throughout Canada for youth with episodic disabilities. Amongst the wealth of information shared today will be actionable items to create more inclusive, equitable workplaces that truly meet the needs of youth with episodic disabilities. Welcome, Tess and Home.
Thank you, Chloe. So should I just kind of take over from here? Okay, wonderful. Let me just share my screen. Can everyone see okay? Or are you seeing youth episodic, like the title slide? Okay, amazing. So welcome everybody to today's webinar on youth episodic disability and work. We are so thrilled and grateful to have you here. I am a great admirer of NEADS and the excellent work that they do for youth with episodic disabilities, so I am so excited to be here today. Like Chloe mentioned, my name is Tess Kern. My pronouns are she, her, and I am a registered social worker in Ontario and the youth program lead at Realize. I'm also the facilitator for today's session. Like Chloe mentioned, today will feature a report back on an environmental scan I've done, and then we'll feature an esteemed community member and friend of Realize who will share their own insights and expertise on this subject. And yeah, it's going to be a great conversation, I feel. Thank you all for coming together today to talk about something I find an incredibly important discussion to be had. Thank you also to NEADS for having us today and for all the wonderful work you do for this population. And thank you to the interpretation team for ensuring that this session is accessible to all. All right, let's get started. So before we dive in, I would love to build off of the land acknowledgement that Chloe started. And namely, I would like to kind of talk about and hold in mind that as we discuss episodic disabilities and mental health challenges today in youth, it is essential to recognize the severe mental health crisis affecting Indigenous youth in Canada. This crisis is not only the result of historical colonization, but also stems from specific contemporary factors. In fact, Indigenous youth face suicide rates significantly higher than their non-Indigenous peers, with rates among Inuit youth, for example, being 11 times the national average. Addressing this crisis requires a commitment to understanding and integrating Indigenous perspectives on mental health and disability. Traditional forms of healing, including working with land-based medicines, underpinned Indigenous people's mental wellness for generations before being disrupted by colonial forces. Today, many Indigenous youth find the availability of cultural forms of care extremely limited. Solutions for improving mental wellness outcomes for Indigenous peoples need to come from and be led by Indigenous communities and mental wellness leaders. When we acknowledge these specific factors and support Indigenous-led mental health initiatives, we can work towards meaningful change and healing within Indigenous communities. Thank you. And now, kind of just to go over what Chloe has already stated, we will start with a report back, followed by a storytelling session by Rome. And then we will have a question and answer period where I would love to hear from attendees some questions that Rome can answer and wherever else I can help out in that. To start, let's talk about what Realize is. We are a national nonprofit. Our goal is to foster positive change for people living with HIV and other episodic disabilities. We were established in 1998 in response to the HIV pandemic and work towards bridging the gap between the worlds of HIV, rehabilitation, and disability. Our goal is to improve the daily lives of people living with HIV and other episodic disabilities in direct and meaningful ways. And we do this through research, education, and policy advocacy. And just a very shameless plug for my email, you can scan the QR code to send me a note. I'm happy to answer any questions or give you more information about how to get involved with the work we do. So before we proceed, I just want to talk a little bit about disability and language. So at Realize, we are committed to using the social model of disability as the foundation of our work. So what this means is that we understand disability not as something that resides within the individual, but rather as something that occurs between the interaction between individuals, societal barriers that serve to disable them. So while we do use clinical language, such as the term episodic disability, it's important to note that our intention is not to impose a label of episodic disability or a medical model of disability on our community. Rather, we use this term to reflect the diverse experiences of disability and emphasize the impact of language on understanding and advocacy. I feel that when we raise awareness for the term episodic disability, individuals are given a tool that can help them advocate for accessibility and justice beyond a purely medical perspective. As part of this commitment to language, we also intentionally use the term disabled youth rather than use youth with disabilities. This choice aligns with the principles of the social model, recognizing disability as an identity shaped by social, political, and environmental factors rather than an inherent deficit. That being said, language is personal. Some people prefer person-first language, such as youth with disabilities, and we absolutely respect that. What ultimately matters most is centering the voices of disabled people and using language that affirms identity and community. And now we can talk about what episodic disability is. So just to give you a definition that we can use for the purposes of this session, episodic disabilities are chronic health conditions that fluctuate over time with periods of good health or wellness, interrupted by periods of illness or disability. It's like that saying of having good days and bad days. Episodic disabilities are related to a variety of conditions, and other terms you might have heard to describe this experience are things like invisible illness or chronic illness or chronic disease, if those ring a bell for you. So just to really underline the key characteristics of what an episodic disability is and what makes them so challenging is their unpredictable and intermittent nature. And so moving along on this slide here, I have some examples of episodic disabilities. Some examples include multiple sclerosis, lupus, arthritis, and various mental health conditions. Of course, also HIV. Please also know, however, that this list is not exhaustive or complete and is always changing and expanding as the term episodic disability continues to proliferate disability and community spaces. It's really more of an umbrella term. So if this idea of good days and bad days resonates for you, then it probably falls under this umbrella. Let's now talk about the prevalence of episodic disabilities in Canada. To start, about 3.8 million people in Canada live with an episodic disability. And when we focus in on youth, in 2017, it was reported that more than 500,000 individuals aged 15 to 24, or about 13% of this age group, reported having a disability. Of that 13%, over half experienced disabilities that are recurrent or fluctuating, which means episodic. This means that at the time, nearly 300,000 young people were living with episodic disability. And we know that this number has increased since then. We know this because in 2022, the Canadian Survey on Disability showed that 20% of youth aged 15 to 24 had a disability, which means 1 in 5 young people. And it's also important to note that episodic disabilities disproportionately impact marginalized groups, including Indigenous and Black youth. So now that we have an understanding of the prevalence of episodic disability in Canada for young people, I wanted to discuss why employment matters so much and how supportive employment can be truly life-changing for young people with episodic disabilities. For one, research shows that having a job helps build confidence, develop social skills, and create a sense of purpose, which all contribute to better mental health and overall life satisfaction. Work also fosters social inclusion. Forming relationships with colleagues and feeling connected to a workplace can make a really, really big difference in a young person's well-being. And thirdly, a really crucial benefit of employment is access to health insurance, which is often essential for managing episodic conditions. This is especially important for young adults, as I'm sure many of you can kind of recall, many young people lose coverage under family plans or when they finish post-secondary education around age 25. And losing this support can lead to financial strain and serious health consequences. So now that we've discussed the impact of supportive work on people with episodic disabilities, I did just want to touch on mental health conditions, which are often episodic in nature. Some mental health diagnoses would qualify as episodic disabilities because they involve periods of good health interrupted by periods of illness. These fluctuations can be hard to predict, making it challenging to maintain steady employment, relationships, or housing. In fact, in any given week, more than 500,000 people in Canada are unable to work due to mental health issues. These numbers, I feel, highlight just how common and impactful episodic mental health conditions can be. So as we look at ways to improve workplace support and policies, let's keep in mind that for many, these conditions are quite ongoing and require flexible accommodations. One example that comes to mind in the work I do is that many people living with HIV struggle with depression and anxiety. Another example is the COVID pandemic, which has exacerbated many mental health conditions. And it was reported that people are seeking additional support, accommodations, and time off in response to this. Now, after considering all of this, you might be thinking to yourself, gosh, wait, where are we? You might be thinking to yourself, gosh, Tess, to truly support those with episodic disabilities, we need workplaces and policies and resources that address their specific needs. And I would say to you, that's literally exactly what I was going to say. You read my mind. And so I decided to do an environmental scan to assess what supports exist in this country for youth with episodic disability. And to do this, I conducted an assessment of organizations that offer support for this demographic of youth with episodic disability. Overall, we reviewed 50 Canadian organizations, including charities, nonprofits, government programs, and even a labor union, to get a diverse snapshot of what's out there. However, I really want to know that this scan was not about judging the quality of these organizations or programs. We know that these groups are doing incredible, impactful work for our community, but rather we were trying to focus on how often these programs specifically address the needs of young people with episodic disabilities. So in other words, we were looking at availability and not quality. Youth services were a natural starting point, as they help us assess whether youth-specific resources exist for those with episodic disabilities. Additionally, of course, episodic disability services were included just to see how well they address those developmental considerations that are associated with being a young adult with an episodic disability. And beyond that, I also looked at employment programs because, as we've established, they can be incredibly pivotal in the health and well-being of young people, particularly those with episodic disabilities. And finally, I also looked at whether these programs considered the unique needs of marginalized youth, recognizing how systemic barriers such as racism, discrimination, and limited access to culturally relevant care can impact their experiences. Now, at this point, you might be thinking to yourself, well, NEADS would be a great example of one such organization, since they work at the intersection of youth and disability. And you would be right. They are a stellar example of serving both youth and episodic disability, with programs that are both developmentally appropriate to this age and grounded in disability justice and lived experience. So yes, they were part of our scan. On this slide, I have an outline of the methods of the environmental scan. It was quite a standard process, where after identifying the organizations to be included in the scan, we analyzed the services and assessed their relevancy to youth with episodic disability, and then determined their inclusivity to marginalized, disabled young people. Then we determined our findings through an assessment of themes. So pretty straightforward, like I mentioned. So I do want to talk about the word key populations and what this means in the context of this scan. So as I mentioned, while we were actually conducting the scan process, I chose to focus explicitly on finding programs and services created that would be particularly relevant to various populations. So I want to talk more about that before we proceed. Key populations refer to communities and human groups that face social, political, or economic exclusion, discrimination due to unequal power relationships. So for this environmental scan, key populations refers to subsets of youth with episodic disabilities who may face additional barriers or require tailored support due to factors about their identity or experience. So these can include queer, trans, and gender nonconforming youth, Indigenous youth, POC youth, immigrant and refugee youth, and youth in rural, remote, or territorial regions. I think it's also important at this moment to hold in mind that each of these populations is not monolithic, nor is it always effective to group together diverse demographics when conducting research, as the experiences and considerations of each population are unique, diverse, and quite dynamic. So for the purposes of this scan, I just want to highlight that we were including these demographics all within this key populations label, really just to ensure that we were holding accountability and integrating the consideration of diversity and inclusivity into the design of the scan. And again, this is sort of the tipping point of a much larger conversation. And so now digging into some scan results, I'm now pulling up a slide which demonstrates our results, which I will go through verbally in a moment. Overall, this scan revealed notable differences in the availability and relevancy of support services across youth, episodic disability, and employment-focused domains. Our findings revealed varied levels of support. So what that really kind of means is that while some organizations provided targeted support, there was a substantial portion that was only partially meeting the needs of youth with episodic disabilities as a broader demographic. I'll go through the primary findings a little bit quickly right now, and then we can dive into the implications we found in the results. To start, for youth programs, 52% of organizations offered sturdy, relevant youth programs that would be accessible to those with episodic disabilities. Regarding episodic disability programming, 46% of organizations provided comprehensive and relevant programs for youth with episodic disabilities. And finally, in terms of employment programming, about 48% of organizations provided very relevant employment services for youth with episodic disability. As you can tell, despite the high prevalence of episodic disability amongst young people, on average, less than half of organizations included in the scan offer services relevant to this population. So let's talk about why. And to start, I would like to talk about the key populations results. So on this slide here, I have summarized the primary results that we just reviewed to the left, while the right side highlights findings related to key populations. So, despite the high representation of young people with episodic disabilities within these key populations, only 16% of organizations in our scan offered even a single program specifically tailored to any one of these groups. So if you are recalling our data from the previous slide, we had numbers around 52, 46, 48, and in key populations, we're talking about 16%. So when we compare this availability, we see a clear gap. Key populations are represented in less than half of the programs that provide youth, episodic disability, or employment services more broadly. Let's talk about why this might be. And to start, I would like to turn that question over to you. If you feel comfortable, you can pop in the chat. What do you think are some of the main reasons why programs for key populations like queer youth, Indigenous youth, and youth in rural areas are underfunded or less available? If anyone has any ideas. And if not, that's okay too. All right, well, please feel free to continue and pop your ideas in the chat. I have some ideas too, and just for the sake of time, I will continue going through them. So to start, let's just talk about the intersection of race and disability. Intersectionality is key to understanding how people experience their disabilities differently based on overlapping identities, including race, gender, sexuality, culture, socioeconomic status, and more. The term intersectionality was coined by legal and feminist scholar Kimberly Crenshaw to describe how multiple aspects of identity intersect to create unique experiences of discrimination and privilege. This is particularly in the context of Black women and the intersection of discrimination that they face. I think in this conversation, it is essential to acknowledge that certain identities can be emphasized over other in our lives. And this is called by Abes and Wallace intersectional erasure. So now moving on to some recommendations, let's move on to some findings, and then we will talk about some recommendations for employers. So research suggests that multiple factors contribute to this lack of service provision for youth with episodic disabilities within key populations. And these include historical and colonial factors that have shaped systemic inequities and limit access to culturally responsive services. This also includes geographic barriers, which affect youth in rural, remote, or reserve regions, where transportation challenges and jurisdictional issues, such as Indigenous youth being blocked from off-reserve services, can create further obstacles. So systemic fragmentation across local, provincial, and federal service models can also lead to inconsistent youth engagement and some confusion and difficulty on how to navigate these systems. And of course, we also need to acknowledge that for many organizations, they lack funding and staff resources to develop inclusive and culturally relevant programming. And addressing these barriers is very critical to improving access and support for these populations. This can sound like a lot and may feel somewhat discouraging. So I also want to highlight some programs and organizations that have created really incredible, innovative, and inclusive services for these populations. These examples include Indigenous Disability Canada and their comprehensive Indigenous disability services. It also includes the Mental Health Commission of Canada with their First Nations, Inuit, and Métis programs. And this also includes the Ashe Community Foundation with their Black Youth Leadership and Advocacy programs, among many other programs that they offer, among many others that are outlined within the written report of MyScan if you're curious to learn more. So despite the considerations highlighted in this report, these examples really do underscore the importance of these targeted and culturally informed programming. And now we can move on to employer recommendations. So in order to create inclusive and supportive workplaces for youth with episodic disabilities, particularly for those from diverse and intersecting identities, we need intentional and proactive approaches. Based on our findings, 3 key recommendations emerge: specialized, culturally responsive support, targeted hiring and retention practices, and a strong community partnership in local peer support networks. Youth with episodic disabilities, especially those from racialized and Indigenous communities, often face systemic discrimination in hiring. We know this from research. For example, we can cite the 2016 study conducted at U of T by Kang and colleagues, where the main finding was that applications with names made to make it harder to tell that the applications were Black or Asian were twice as likely to receive a callback than these unwhitened resumes. Furthermore, employers should adopt equitable hiring strategies, such as offering targeted outreach programs, ensuring accessible application processes, and prioritizing mentorship and leadership development for disabled employees. And retention is just as important. This means providing flexibility in work arrangements, clear career progression opportunities, and ensuring that workplace cultures are actively challenging ableism and discrimination. And employers do not need to work in isolation when addressing these needs, particularly for young people with episodic disabilities. Partnering with disability organizations like Realize or NEADS, partnering with cultural groups or community advocates can provide really valuable insights and resources to support employees effectively. We have information out there, and there are certainly conversations to be had. And to end this section, I really want to end with a quote from Kimberly Crenshaw from 2015, where she says, "The better we understand how identities and power work together from one context to another, the less likely our movements for change are to fracture." Now, let's move on to the not disabled enough gap, another finding from our environmental scan. So, the not disabled enough gap in the context of this scan refers to young people with episodic disabilities who don't qualify for support because they don't fit strict program criteria. And after the scan, I had a few thoughts as to why this happens. For one, over 15% of programs assessed were designed for disability more broadly, often prioritizing visible or permanent conditions. This means that episodic disabilities, like fluctuating symptoms or invisible conditions, are overlooked, leaving young people without adequate support for this experience. On top of this, another thing we noticed was that more than half of the disability programs included in the scan were tied to specific diagnoses. For example, organizations exclusively serving multiple sclerosis, Crohn's colitis, etc. And I want to acknowledge this approach is very effective as it provides more individualized and specified support for people with a certain lived experience. At the same time, it does leave out young people with less common or overlapping conditions, which can make it harder for them to find relevant services. This can lead to barriers of access, feelings of exclusion, and increased marginalization. If we want to bring this back to the workforce, this gap shows up as a lack of accommodation and support. Without this flexibility and understanding from employers, many young people with episodic disabilities may struggle to maintain jobs and can limit their career growth and financial security. So another major contributing factor to the not disabled enough gap is the difficulty of diagnosing episodic disabilities. Many services in this scan required a formal diagnosis to access support, which is a major barrier for young people whose symptoms are just emerging. This is common in conditions like multiple sclerosis, lupus, and Crohn's disease. Other things I'm sort of thinking of is some episodic conditions like long COVID lack clear diagnostic criteria due to this fluctuation of symptoms and the inconsistency of timelines, which can make it even harder for young people to qualify for services. This struggle to get a diagnosis is often called a diagnostic odyssey, which is a term used in rare disease research to describe the long and complicated journey that people go through to get properly diagnosed. For those with episodic disabilities, This odyssey can mean delayed or denied access to vital services and care. At work, requiring a formal diagnosis for accommodations creates extra stress, more uncertainty, and barriers to employment. Young people may struggle to access workplace accommodations before they have a confirmed diagnosis, or may struggle to manage their symptoms effectively in the workplace without managerial support. And beyond employment, this diagnostic barrier also affects clinical care. It can affect financial support, for example, in Ontario, the ODSP program, and access to research trials, which can further compound the health and financial challenges young people with episodic disabilities face. I have a few ideas about why this might be. Firstly, this diagnostic odyssey in part may be due to lengthy wait times for individuals trying to access healthcare services. Research from the Fraser Institute in 2022 has suggested that healthcare providers reported an average wait of over 27 weeks from primary care referral to service provision. This can lead to lengthy wait times to receive a diagnosis. For example, the ME and Chronic Fatigue Syndrome Society of British Columbia reports that patients have waited an average of 4 to 6 years for a diagnosis. 4 to 6 years. Furthermore, Parkinson Canada reported that in 2018, 2 in 10 people said they waited over a year to receive a formal Parkinson's diagnosis. And this trend is seen more broadly, even in international studies. Secondly, some research has suggested that due to the biomedical model, some health professionals experience skepticism or a reluctance to make a diagnosis on a disease such as chronic fatigue syndrome, as this model suggests that there is no identifiable pathology found, then there is no diagnosable illness. What might be happening here is that in some cases, health professionals are practicing on a somatically grounded basis, where patients are thought to have physical symptoms as a manifestation of social or emotional issues. This has been described by, for example, some chronic fatigue syndrome patients as a blame shifting tool, wherein they are credited as being the source of their own illness. In other scenarios, something that we have discussed at Realize with the community is that with episodic disabilities, the fluctuating nature of the condition means that while one might experience bad days with symptoms at an incredibly unbearable severity, if the day of a given appointment with a specialist is on a day where your symptoms aren't flaring up or having a better day symptom-wise, a patient might not get the sort of diagnosis they need. It might even lead to delays in treatment. This sense of medical invalidation is commonly referred to as medical gaslighting in patient circles and among some research, and can lead to vastly negative consequences. Some episodic disabilities, such as Lyme disease, long COVID, migraines, and fibromyalgia, have been reported by researchers to experience apprehension in healthcare settings, wherein reported symptoms are disregarded and might even lead to misdiagnoses, delayed diagnoses, or no diagnosis at all. And it's important to acknowledge that for this kind of medical invalidation, as well as many of the other experiences reported in the key findings, they do not occur within a vacuum. Patients with episodic disabilities with intersectional identities are faced with exacerbated experiences of medical invalidation, as the systems and institutions they have to navigate are fraught with oppressive, racist, and colonial ideologies and facets. For example, the term anti-Black gaslighting refers to the experience of Black patients' symptoms being dismissed or devalued by healthcare systems due to the historical and systemic racism prevalent throughout healthcare institutions. It has also been suggested that this attribution of the reliability or unreliability of patient reports of symptoms is significantly influenced by misogyny within the medical system. This can lead to women's symptoms being frequently invalidated or attributed to psychological rather than physiological causes. Beyond all of this, once you have the diagnosis, however, the odyssey is not over. Finding the right medication and specialist care can take years, involving numerous consultations and adjustments. This ongoing process can be physically and mentally exhausting, complicating efforts to manage the condition and maintain employment or education. For example, individuals with conditions like fibromyalgia might need to try various treatments before finding one that works. And this is all while navigating potential side effects and delays in accessing other specialized care. So it's an incredibly complicated process. The word odyssey really does this experience justice. You may be wondering to yourself, okay, what can employers do about this? I have recommendations. First and foremost, trust disabled young people. They are experts in their own needs, and waiting for a diagnosis should not be a prerequisite for support. Additionally, rather than basing accommodations on medical labels, workplaces can implement developmentally appropriate, personalized support plans that adapt to the dynamic nature of episodic disabilities. Research emphasizes that these tailored approaches are really key to ensuring disabled youth receive the flexibility and resources they need. And furthermore, rather than focusing on diagnosis, employers can shift towards focusing on functional abilities and functional disabilities. In other words, what can someone do? What do they need support with? And how can the workplace adjust to enable success? When we take this approach, employers not only create a more inclusive, accessible environment for young people with episodic disabilities, but it also contributes to a cultural change within your organization, which is quite essential in terms of tackling stigma, for example. And now I will talk about our final theme and finding for this scan for today, and that is the need for transition support for young people. To start, transitioning from high school or post-secondary education into the workforce can be hard for all young people, and I can speak to this myself. And for this 20% of youth in Canada living with disabilities, this challenge is significantly high. And the data reflects this. In 2023, the employment rate for youth aged 15 to 24 with a disability was 51% when compared to about 10% of their able-bodied peers. Now, without proper transition support, youth with episodic disabilities often face immediate challenges like missed workdays, lower earnings, and higher unemployment rates, as we just discussed. And over time, these barriers can lead to limited career opportunities, worsening health, and an increased reliance on government support to meet basic needs. So as you can see, this issue of transition support becomes a public health and social issue. Now, there are many reasons why this might happen. For one, as I think we've established already today, many workplaces for hiring and accommodations fail to account for the fluctuating nature of episodic disabilities, which can make it harder for young people to find stable jobs that enable them to advance in their careers. This is incredibly frustrating for many talented young people who are eager and just want the same opportunities as their non-disabled peers. And beyond logistical barriers, stigma and misconceptions about disability also play a huge role. Research has shown that 12% to 51% of disabled employees face attitudinal barriers at work, with stereotypes about their abilities and reliability impacting their career growth. So when looking at this issue, it became clear to me that something was missing. So let's see if I have some ideas. I do have some ideas. Research highlights the importance of integrated transition support programs, not just for providing resources, but for creating a more inclusive workplace that really supports young people with episodic disabilities. This integrated transition support in particular can play a really crucial role in bridging that shift from education to employment. So integrated supports can offer consistent, individualized guidance in the context of the workplace that can help to address these attitudinal barriers, build self-efficacy, and foster a welcoming, inclusive environment that values diverse ability. Research indicates that, for example, vocational programming can play an important role in improving the chances of youth with disabilities being hired during this time of transition as well. So think co-op programming or different on-site placements. They're great in terms of supporting this adjustment period. So we can dig into this a little more, but before we do, I wanted to know what you think. I want you to think to yourself, if you yourself could add one policy or support to make workplace transitions easier for youth with episodic disabilities, what would it be? And now that you've got all these great ideas, I will share some of my own. So to build a supportive workplace for youth with episodic disabilities, we have several key recommendations. These strategies not only provide a starting point, but also emphasize the importance of engaging with disabled youth to ensure accessibility remains effective and meaningful. To start, I would recommend offering flexible work arrangements. So you can offer part-time, remote, or hybrid work options. You can allow for regular breaks to accommodate fluctuating health needs. And like we talked about a little earlier, implementing a gradual role integration to reduce stress and help young people build confidence in their role. And again, like I mentioned about vocational programming, this training and hands-on experience can provide great support in sort of bridging that gap. And beyond that, when we provide disability-informed training to managers and other staff, we are again reinforcing a more inclusive culture, which is essential in providing proper support to young people in the workplace. And finally, a recommendation that comes out very frequently in the research is support for the development of soft skills needed for longer term success. And so I think really one of the kind of main takeaways here is being mindful of not only short-term success in a role, but also your employees' longer-term success, as it all does play in to a better workplace for all. So my final thought here is these steps